Hundreds of Juba residents are receiving free medical care at a medical camp organized by the Indian Association in South Sudan. India's ambassador to South Sudan says the medical camp is intended to treat patients who can't afford to go to hospitals due to financial constraints. He says many South Sudanese suffer because there are not enough equipped medical facilities to treat people around the country. Winnie Chirino has the story for VOA from Juba.
Ravindra Prakash, who chairs the Indian Association in South Sudan, says the association hired half a dozen Indian doctors, 2 gynecologists, 2 general surgeons, a nephrologist, and an orthopedic surgeon, and flew them all to South Sudan to diagnose and treat the sick free of charge.
This medical camp we have started today. It is with the concept that we can at least give facilities, medical facility to our sisters and brothers of South Sudan. Though we cannot do too much in 3 days, but it's kind of consultation and advice to our friends here. And the small sickness can be treated. But for the bigger things, our doctors can advise what to do next.
55-year-old Joyce Jogo says she has been suffering from ulcers and diabetes for the past 5 years. Jogo says an Indian doctor examined her and prescribed some medicines to treat her illnesses. Speaking in Arabic, Jogo says she was glad to receive free health care from the Indian Association in South Sudan.
People
are happy because they have got something for free to help themselves. But if they will treat people every day, it will be better so that it can help the poor.
19-year-old Akwak Peter says he has been living with hepatitis B for more than 2 years and came to the camp to see better medication from the Indian doctors. Peter says he expected more than just being referred to Juba Teaching Hospital for a test.
To me, I think they have been fair, and the problem is that somehow they are not much organized. Otherwise, they would have come with the equipment for all those kind of tests because the statement on the flip chart was that they can do or they can care for all kind of sicknesses. But to me, things are not the way it has been written there. There are things that they are not doing for now.
Indian nephrologist Suresh Chandra says it is his second time attending a medical camp in South Sudan. He says the doctors are ready and willing to screen and advise the patients they see.
We see patients with diabetes, which is a metabolic disorder. We see a lot of patients with joint problems here because of malnutrition, because of sports injuries, because of inadequate nutrition. They develop that. We see a lot of hepatitis in this country. Besides other common things which everyone can see, common things like common cold, fevers, typhoid, malaria.
Subramanian Dakia Mothi, India's ambassador to South Sudan, says this is the 3rd time the Indian community has organized a free medical camp in South Sudan. He says he understands treatment outside the country can be very expensive, so he's encouraging South Sudanese to take advantage of the free medical camp.
Instead of sending people to India, spending a lot of money on transport, we brought the doctors from India to help our South Sudan friends. Yes, India and South Sudan friendship is very strong and very close also for many years. We realized so many people are suffering in this country for lack of medical facilities. Then we realized this kind of things will definitely help the poor people and needy people.
Mothi says the Indian Embassy and the Indian Association in Juba will organize more free medical camps in South Sudan, but did not specify when or where that will happen. For VOA News, I am Winnie Chirino in Juba.